and welcome to the Art of Being Human. I'd like to start off by answering a question that came up after the last segment when somebody said, if aspirin is an NSAID, and it is, and it has a certain amount of stroke potential if you take it, then why do they give aspirin to patients after a heart attack? Well, it is also a blood thinner, and sometimes a patient really needs to have a blood thinner. So that's the reason why. But the stroke potential would come if you have from a very long period of use at a higher dose. So they use baby aspirins. But I know that there are some patients, such as myself, heart patients, that are not allowed to use aspirin because they're on other kinds of blood thinners, and aspirin is another blood thinner, and you can get just a tremendous potential for blood thinning. And so I was told that I would never use an aspirin again, but I would continue on blood thinning medication for the rest of my life. So there is a potential for stroke if you're using it at a very high dose for a very long period of time. So that's what you have to consider. You just have to go by what your doctor says as to what would be right for you. So I want to get on now in addiction. What is it? How do we get addicted? Because it's a physiological thing. A lot of people use AA. They use Alcoholics Anonymous. It was founded in 1935, and it's been successful in a lot of cases. But if you look at the broad spectrum, what I have read is that Alcoholic Anonymous succeeds in about 20% of the time. That's still a lot of people. There are a lot of people that are alcoholic. But if you look at this chart here, it succeeds 20% of the time. But it's most effective, it can get up to 40% of the time if the addicts continue to go to the meetings even after they have stopped drinking. I know I've counseled people who are alcoholics, and they go to meetings sometimes 5 or 6 times a week, and that's the way they work with it. If they go less time and they don't focus on it and skip meetings, then they're very, very tempted to go back to drinking. So a lot of people will go to AA and they'll go 5 times a week or so, almost every single day in the week, in order to keep control and not go back to drinking. Because as they tell me, the craving is there. You know, it's very hard to get past that craving. Why do people want drugs and they want more and more drugs? It's because when the addiction occurs, there is an intense craving for the drug. And if they could get rid of the craving, then they could get past the addiction a lot easier. The sad fact about drug addiction is the fact that you can know everything about it. You can know the damaging of things it does to your system. You can know how bad it is to your thinking. You can know how it affects your digestion in different parts of the body. You can talk about you can talk about what goes on in drug addiction, but the fact of the matter is, if you crave it enough, you will do anything you can to get it no matter what. You know the outcomes, you know the bad effects of it, you know it's destroying your health, you know your brain is not working right, you know the parts of your body aren't working right, and yet at the same time, despite all of this knowledge, you have to have that drug, because the craving is so intense. And that's what happens in drug use. It doesn't happen quite as much in marijuana, but it can. Because of the psychological dependence on it, you can crave it very much. And so therefore, it's important just to make a decision early on in life. You're not going to drink. You're not going to do the things that could cause you to become addicted. And I also consider there are chemicals involved in the process of being addicted. There are biochemicals in the brain. There are some people who can get hooked on a drug the first time they take it. They're already addicted the first time they take it because of the biochemistry of the brain. There are other people that can drink and take drugs for quite a while before they become addicted. In the end, though, it's a matter of biochemistry of the brain. And if you drink enough or if you take a certain drug enough, you will at some point be addicted to it, just by virtue of the fact that you've had it all along. So we have to be very careful with the addictive kinds of drugs and try to stay away from them. So how do they become addicted? Well, let's start off with the Alcoholic Anonymous. It goes up to 40% effectiveness if addicts continue to go to the meetings even while in recovery. And people make friends there, and people get support there, and they support each other there. It is a very, very helpful organization. Addiction affects the brain, and where it hits is the neurotransmitters. They become out of balance, memories become destroyed, emotions become exploited, and the cravings become intense. I'm basically concerned about what happens with the neurotransmitters and the cravings. Now I'm going to get a little bit off course and tell you a little bit about LSD. I'll be going into LSD later, but this kind of brings it up. LSD stands for lysergic acid diethylamide. That's what it stands for. And it is a psychotropic type of thing. It causes you to have hallucinations and so forth. Now, with LSD, the chemical structure of it is very, 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 very similar to one of the neurotransmitters of the brain, to the point that if a person is taking LSD, the brain is tricked into responding to what it thinks is its own neurotransmitter. It's not its own neurotransmitter, but it is so similar that the brain cannot tell the difference between LSD and the neurotransmitter, so it starts to respond to it as if it were a neurotransmitter. And as a result of that, you get hallucinogenic experiences. Now, hallucinogenic experiences are experiences where you have hallucinations, but they're not a true hallucination technically, because they're coming from something you have put into your system. They're not coming from what's within your system. Now, people who are psychotic, people who have serious mental diseases, and I'm thinking basically about schizophrenia here, do have hallucinations. And they're true hallucinations. They're coming from the neurotransmitters and the biochemistry of the brain being out of balance. When you add something from the outside and put it into your system that not normally is there, such as LSD, you are tricking your brain into responding in a very psychotic way. So the hallucinations that you get, or what's called hallucinogenic experiences, are very, very similar to a regular hallucination. To any person, you would not be able to tell the difference. However, there is a difference in the way that it originates. So technically, there is a little difference. So what you're doing to your system with LSD is causing it to hallucinate, causing it to act in a psychotic way. Now, I don't know of any antidote to that. I don't know of any way that you can have an antidote to that. But it's very unfortunate if you have a person that's having an experience and they're not seeing things right or they're not hearing things right. Sometimes you can help by talking them down. I knew an individual who was on a pain patch for quite a while. This was for medical reasons. And when they took the pain patch away, this person was basically having withdrawal experiences as if they had taken a hard drug. But the hard drug was given to them through the pain patch to control pain due to a surgical procedure. So I would just say to that person, you know, what you're seeing and what you're feeling is not real. It's not occurring. You're experiencing it like it's a real thing, but it's not a real thing. If you can separate in your mind, because the person was not psychotic, if you can separate in your mind that this is an experience that you're having and it's not the true you, and it's just an experience, then eventually it will be easier for you to handle it. Now, of course, with no more drugs in the system, eventually the symptoms went down and stopped, although once in a while there's still a little regression there, and some symptoms come back. A person who stops taking LSD will eventually stop having those experiences. Unfortunately, there is a residue of LSD that stays in the spinal column. And when it stays in the spinal column, you can test it, and it's still there. So these people occasionally have flashbacks, and then when they have the flashbacks, they're having the hallucinations and things that they used to have. It comes back on them, but they have no idea when it's going to happen. But there is still some LSD in the system. And I understand that with LSD, if you dry it, if you take a little spot of a little drop of it, put it on a piece of cloth, let it dry, even after a year, if you lap it or something, enough of it will get into your system so you'll get a reaction to it. So it's a very, very potent, very powerful thing. Now, the reason I'm bringing all of this up is the fact that we do have a body, we do have biochemistry, and the drugs affect our biochemistry. And if they're going to affect the neurotransmitters, which are in the spinal cord in the brain, but they run up and down the system, that you're going to have some serious effects on your consciousness, what you see, what you hear, how you feel. And so you have to be very, very concerned about taking drugs and putting things in your system that are not mandatory to be there. Even marijuana can give you hallucinations. If you get a high enough dose, it can act as a hallucinogen if you get a high enough dose. So it's just important that you remember the danger that you can put yourself in if you are insisting on using drugs. And a lot of people fall into it. Teenagers tend to think they're invincible. No, nothing's going to happen to me. I can control it. I've got a mind. I can say no. But the thing is, once you get hooked, you can't, because there's an actual physical change in your system. And you can't fight that physical change any more than you can fight a learning disorder. If it's there, it's there. So let me go on with this. So, most effective, let me go down here. The addiction affects the brain. The neurotransmitters are out of balance. I know I've read this before, but let me just repeat it again. Memories are destroyed, emotions exploited, and the cravings are intense. And addictions make people repeat behavior, even if they understand the consequences of their behavior. You know, most people, until their brain develops, which is about the age of 25, mid-20s, they don't fully understand the consequences of their behavior, because the part of the brain that would allow them to understand that isn't functioning. It isn't functioning mainly because it hasn't grown and developed to the point where it can. So if you take a teenager and they start experimenting with drugs, they feel they can do anything, nothing's going to hurt them, they can always change their way of life, and then they find they're in the grips of this horrible addiction because their biochemistry has changed. And in a developing brain, that's very dangerous to have your biochemistry change, because you have to grow into maturity, and it impacts the way that you grow into maturity. And at the same time, even in adults who are mature and they feel they can handle anything, they get involved with drug addiction and they can't handle it at all, because it's their body changing. You cannot argue away what's happening in your body. You cannot say, okay, be gone. You know, if you are mentally ill or if you have some other kind of illness, you can't say to your body consciously, I don't want you to have that anymore, just go away, and it won't happen. You lose control because you never had it to begin with. So let's go on with this. Neurotransmitters in the system, body chemistry, it's everything in terms of addiction and everything else. Okay, now the National Institute on Drug Abuse, NIDA, has come out with a definition of addiction, and this is what it says. You are unable to stop when you want to, despite being aware of the consequences. It permeates your life. You spend more and more time satisfying your cravings. This is from Dr. Nora Volkow, director of NIDA. And this is basically what I've been saying all along. When you pass that threshold of, oh, it's nice, I like it, I want it, to the point where you're saying, I need it, I've got to have it, I can't live without it, then you have crossed that line, and then you are physically addicted. So let me read this again. If if you are unable to stop, or you are unable to stop when you want to, despite being aware of the consequences, of the adverse consequences, it permeates your life. You spend more and more time satisfying your cravings. So addiction isn't just about substances. Addiction disrupts the process of pleasure. You create more and more urges, and you keep wanting more and more. This is from Dr. Martin Paulus, who is a psychiatrist. It doesn't matter how bright you are. It doesn't matter how much you know. It doesn't matter how much resolve you have. It would seem like if you could get a handle on it, you could get rid of addictions, but what happens is that there is such a biochemical change in your system, and you have to respond to the biochemistry of the brain, the biochemistry of the nervous system, what's going on in the spinal cord, what's going on with the neurotransmitters. You are helpless to get rid of this addiction unless you go through the process of actually stopping, and best to do it when you have people around that understand the process and they can work with you to help you, either in a hospital setting or in meetings such as AA, which are very good. You have to be able to disrupt that. There's a whole pattern of events that happens, and you have to be able to disrupt that pattern of events in order to stop taking drugs. But you can't do it on your own, because the grip that it has, due to the fact that the neurotransmitters and the parts of your body controlling you have changed, physically changed, due to an addiction, due to the fact that you have brought into your system things that should never have been there. I know of a lady who was trying to get marijuana legalized. This is a few years ago. And she said, if I don't have marijuana, I will die. She had cancer, and she felt that marijuana would help her survive somehow. And she says, I will die without marijuana. And I didn't know who she was personally and wouldn't have had a chance to talk to her. But what I wanted to say is that marijuana is not natural to the system. Your body does not produce it. You cannot die of a lack of marijuana. You could die from a lack of water, you could die from a lack of food, you can die from a lack of all kinds of things, but certainly not marijuana, because it's not natural to the system. In order to need marijuana, you have to take enough of it so that it changes your biochemistry so that you have a need for it. But the need wasn't there originally, and you wouldn't die from a lack of something that your body doesn't produce. You know, so you have to stop thinking about, you know, what happens to you physically, and think about what happens to you in a long-range basis if your biochemistry changes. So the brain has to respond. Neurons release dopamine, and it is a neurotransmitter, into the synapses. Now, we've gone into the brain structure to a certain degree, and I've shown you diagrams of what a neuron looks like, and it has the axons and it has the dendrites, and it fires, and the electrical impulses go down, and then they get into the synapse, and then you have the neurotransmitters in the synapse that cause it to jump to the next neuron, to jump to the next neuron, and so forth down the line. But what happens is that the neurotransmitters are affected by the dopamine. It is a neurotransmitter, and it gives a sense of pleasure. If you have too much dopamine, and it's taken into the receptors of the sending cell, then you have problems. What happens is there is a nerve cell that produces GABA. GABA is a neurotransmitter, and it tries to stop a dopamine receptor from getting too excited over the fact that it's getting a drug. This is very complicated. I don't know how much I can go into it, but it tries to prevent the sending nerve from becoming overstimulated. So you take a drug, and you will overstimulate the neurotransmitters, you'll overstimulate the nerves, and GABA is trying to stop the overstimulation of the nerve, and there's kind of like a fight in the system about this. I know it sounds horribly complicated. If you increase the amount of dopamine in the synapse, you increase pleasure. And what the GABA, it tries to stop that so that you don't have such a reaction to the drug. But you can see just by what I'm telling you how much you mess up what's happening in your body if you take drugs and they get into the synapses, and then there's an interplay between the drugs and between the neurotransmitters and the nerve cells, and you can do a horrible job to your system. You increase the amount of dopamine, and it increases pleasure, as I said before. Addiction is going to occur when the drug use interrupts and disrupts the balance of the circuits of the nervous system. So you're actually changing the circuits of the nervous system, and that's how you become addicted. It changes the brain chemistry. I don't want to make this more complicated than I need to make it, but it interrupts with the circuits of the nervous system. It interrupts the neurotransmitters and how they're functioning in the system, and as a result of that, your body becomes very, very addicted, and you have to try to bypass all of that and just get back to a normal life without that, and it's hard to do because you have the cravings to deal with. And so I think a lot of the focus on medications is to stop the cravings. If you can stop the cravings, you've got more control over what you do and what you don't do. So I'm going to close it here. We're going to continue with this next time. I want to give you a list of the major drugs that people become addicted to and what happens with the addiction, what the symptoms are, what the withdrawal symptoms are, and so and to give you as much help as I can if you yourself are on drugs. So we'll close it here. Please join me next time.